France is taking a step back from the COVID-19 mRNA vaccines for their healthy population. They are acknowledging the low uptake and the weak durability. That is going to be the subject of today's episode. And so, from Trial Site News, I am Adrian, and our episode is starting right now. So, the French National High Authority for Health, or HAS, recently recommended that a bivalent Omicron booster dose of the mRNA COVID-19 vaccines would be available this fall for people deemed at risk, from the elderly to the immunocompromised, as this Western European nation moves to an annual paradigm similar to the influenza vaccine that we see here in the US. People that French health authorities are suggesting should consider a booster include individuals aged 65 years and above, those diagnosed with comorbidities, pregnant women, and the immunocompromised, as well as regulatory people in constant contact with the latter, such as health professionals. Importantly, the direct French National Authority for Health recommendations are critical of the current COVID-19 mRNA bivalent Omicron booster vaccines. They acknowledge poor vaccine durability and incredibly low vaccination coverage. Now, as you would expect, the French Society via the French National High Authority for Health are careful in how they express their growing critical views of mRNA vaccines, while at the same time recommending it still for the most at risk for their society. The French press, meanwhile, such as Le Monde, are doing their level best to minimize the critical edge within the direct recommendations by the French High Authority for Health. So what's driving these changes? Well, according to the report in France titled Vaccination Strategy Against COVID-19, Anticipation of Vaccination Campaigns in 2023 Vaccine Recommendation, they wrote that despite the uncertainties related to the evolution of the SARS-CoV-2 virus, the French High Authority for Health issues these recommendations relating to the anticipation of vaccination campaigns in 2023 with the aim of guiding the public authorities. And the HAS is emphasizing that their decision-making is based on a dynamic unfolding reality where they must balance the following elements. First, epidemiological data showing the predominance since the beginning of 2022 of the Omicron variant and the uncertainties related to the SARS-CoV-2 epidemic. Next, low vaccination coverage relative to the booster dose. Then we have the probably high but as yet unknown proportion of the population with protection related to natural or hybrid immunity. The additional protection provided by the administration of a booster dose with the bivalent mRNA vaccine against the occurrence of symptomatic infections, hospitalizations, and deaths. Decreased vaccine protection against infection and or symptomatic forms after a few weeks regardless of the age of the person. And finally, maintaining a high level of vaccine protection against severe forms without it being possible on the basis of currently available data to estimate residual protection beyond 9 months. This decrease in protection is faster for people aged 80 and over. Now, importantly, the HAS isn't recommending extra doses for healthy people, including children, as the pandemic-driven paradigm is now clearly transitioning to an endemic way of life. While independent, this influential body's opinion are typically adhered to by the French government as they start to classify the COVID-19 shots much like the flu vaccinations. Here is what their press kit said on the matter. They said, from a practical point of view, and for reasons of mobilization and logistics, it seems relevant to couple the autumn vaccination campaign against COVID-19 with that of influenza that targets the same populations, and to consider that the start date of the campaign against COVID-19 will be determined by the start date of the campaign against seasonal influenza. To date, the HAS no longer recommends primary vaccination against COVID-19 in the general population. But it nevertheless insists on the importance of leaving the possibility to any person who expresses the request to be able to benefit from a booster dose and to be able to be reimbursed for this vaccination. In addition, it considers that the possibility of setting up a vaccination campaign at any time should not be excluded if the epidemiological situation justifies it, in particular for immunocompromised and/or vulnerable persons, or even on a larger scale in the general population, given the unpredictable nature of the emergence of variants. So, what then were their list of recommendations? The HAS recommends vaccinating against COVID-19 in autumn 2023 people most at risk of severe form of the disease, in particular people aged 65 and over, infants from 6 months, children, adolescents, and adults with comorbidities with a higher risk of severe disease, immunocompromised people with any other comorbidity, taking into account the individual medical situation as part of a shared medical decision with a healthcare team, people living in the entourage or in regular contact with immunocompromised or vulnerable people, including professionals in the health and medico-social sectors. Next, for reasons of mobilization and logistics, the HAS recommends coupling this vaccination campaign with that of influenza and to consider that the start date of the campaign against COVID-19 is determined by the start date of vaccination against seasonal influenza. For people aged 80 and over and the immunocompromised, people whose immune protection decreases more rapidly over time, as well as for anyone at very high risk according to each individual medical situation, and as part of a medical decision shared with the healthcare team, the HAS recommends that they can benefit from additional vaccination from spring. And then the HAS goes on to say that based on the data currently available, the HAS no longer recommends primary vaccination against COVID-19 in the general population. However, the HAS insists on the importance of giving anyone who expresses the request the opportunity to benefit from full coverage of their vaccination against COVID-19. The HAS recommends not excluding the possibility of setting up a vaccination campaign if the epidemiological situation justifies it. The HAS preferentially recommends the administration of bivalent vaccines adapted to Omicron, whatever the vaccines previously administered. Regarding the administration of the additional booster dose, the HAS recommends respecting a delay of at least 6 months since the last dose of infection, regardless of age and recall rank. And the HAS stresses that it is essential to continue efforts to vaccinate people at risk who are not vaccinated or have not yet received their additional booster dose, especially the oldest for whom full vaccination coverage, including a booster dose, is still insufficient. And so it would seem that overall French society is moving fully into an endemic mode. The shift to slide away from a pandemic paradigm where boosters are recommended for everyone every 6 months or so continues. This is a trend I would imagine that we will be seeing happening all over the world before long. The vaccine's inability to stop transmission as well as its waning immunity, along with the immunization exhaustion by the public, is seeming to force the hands of government leaders around the world. The only question remains is, what comes next? Time, of course, will tell. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday, or for written content every day, 7 days a week, feel free to check us out at trialsitenews.com. And as ever always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.